Good evening, everyone. Welcome to the session. Good evening, Dr. Kannan.
Good evening.
Thank you for taking out your time, and I would like to welcome all of you once more to this session today. I'm Sauraveshwar Sen from Catalyst, welcoming all of you to this interactive session with Dr. Ravi Kannan. Just to start off our discussions, I would like to help you understand a little bit about Catalyst. At Catalyst, we train, mentor, and groom students, young professionals to step up into careers connected to the social development sector. And we are very pleased to collaborate with Cachar Cancer Hospital and Research Center. And to start the session today, I would firstly like to request all of you that please take your time and do interact with Dr. Ravi Kannan, whom we have been, very privileged, I would say, in this, hour of crisis, to take out time and be with us to address some essential queries to take things forward. So whenever we look into our phones nowadays, whether we browse social media or we watch the news, we only see how COVID has affected the country. We seem to have forgotten that there is a whole new challenge with cancer patients who are afflicted with COVID. Cachar Cancer Hospital is a charitable organization that caters to the medical needs of cancer patients who hail from remote parts of Northeast India. They are now facing a double challenge. Not only do they have to continue treating cancer patients, they are facing a large influx of cancer patients afflicted with COVID. To talk to us about this double challenge of cancer and COVID and how these patients need to protect themselves, we have Dr. Ravi Kannan, Director of Cachar Cancer Hospital and recent recipient of the Padma Shri Award, joining us today. Right at the onset, once more, Dr. Kannan, I would like to thank you for your time. I would like to thank Darshana, Naresh, I can see Sharmi, all representing Cachar. I would like to thank Srishti, Himani, Sudeshna, and many of the students, from Catalyst who actually enabled this session to take place. Dr. Kannan, starting off with you, we would firstly like to congratulate you for being bestowed with the Padma Shri Award. And I was just going through some of the stories in recent past where you clearly mentioned that the award belongs to the entire staff members, the entire team at Cachar. Of course, talking about cancer, we also know, Dr. Kannan, that we have cancer, which is very sustained, always persistent. For the last 1.5 years, we have COVID, which has created great levels of uncertainty. But amongst the two C's in cancer and COVID, thankfully, we have Cachar. And if you can just allow us to understand from your end, how do we take this forward in terms of knowing what Cachar is doing at this moment and what it has done in the past, and also to help us understand our way forward. Over to you, Doctor.
Thank you. Thank you very much. Cancer care, healthcare for that matter, is an enormous, giant teamwork. That includes the staff in an organization. That also includes countless people outside the organization who enable many things to happen, sometimes without even realizing it. Volunteers, friends, administration, district administration, so many people are directly and indirectly involved in ensuring that a particular organization is able to deliver healthcare. And ultimately, I think that is only just because it is, that whole network, that makes life better for fellow human beings on earth. Now, cancer is a lifestyle disease. To a very, very large extent, it's a lifestyle disease. And COVID is also a disease, is also an infection which can be modified by lifestyle changes. And I think the key to handling both problems is to ensure adequate public education. Cancer, we have lifestyle, tobacco, alcohol, inappropriate diet, lack of exercise, untreated infections, mostly lifestyle related. COVID is a disease, is an infection which has come from somewhere, but it is human behavior that causes it to spread. And we know there are good public health measures that we can take, we can implement, that can modify the trajectory of the disease. We have what is called R number, R number, reproduction number means one infected individual can infect how many other individuals during the course of his or her illness. And that is very largely influenced by, how we conduct ourselves, whether we mask, whether we protect ourselves, whether we maintain social distances, whether we maintain hand hygiene. And, if all of us were to follow, some public health measures, if we were to make sure that we discharge our social responsibilities, we must always ensure that we wear masks which are very appropriately fitted, covering the nose and the mouth, multi-layered, tight-fitting masks, that we don't go out unless we need to, that we avoid getting into crowds, that we don't go, to the temple or the masjid or the bus stand or the market unless we have to do it for an essential thing. And if we observe hand hygiene, to a very large extent, we can reduce the R naught. The transmission rates can be reduced to a very, very large extent. On top of that, if as individuals and as government policy, we test, trace, and isolate, we will add more value to the efforts to reduce the transmission rate. And now the vaccine is available. I know there are shortages, but that is okay. It's bound to happen. But as and when the vaccine becomes available, if all of us, instead of questioning the efficacy and the safety of the vaccines, if all of us go and get ourselves vaccinated, whatever protection it affords, I'm not saying the vaccines are, offered 100% protection. They offer some protection. That protection will further reduce the risk of transmission. If nothing happens, at least it will help reduce the intensity of the infection if and when it occurs. The vaccine may not be disease preventing, but it will be disease modifying. And so, both these diseases are either caused by lifestyles or aggravated by lifestyles. And I think the most important thing, all of us as medical professionals, as educated people, as people in society, as leaders of organizations, the most important thing that each one of us can do is to create awareness and ourselves set examples by following all these measures. For cancers, don't use tobacco, don't use alcohol. There is no moderate use of alcohol. Don't use areca nut. Eat healthy, exercise regularly, and treat infections promptly as and when they occur. Vaccinate yourself whenever possible for hepatitis, for a whole lot of diseases. For COVID, mask, maintain social distance, don't go out into crowds, observe hand hygiene, test yourselves or your colleagues or your friends whenever there is a suspicion of COVID infection, and isolate yourselves, and vaccinate yourselves whenever the opportunity presents. As an organization, during the last year, we've been very actively engaged in creating public awareness. We've been doing cancer awareness for many, many, many years now. And for COVID, it's a learning for all of us. We're also learning. For cancer awareness, all our awareness camps used to be in person, going out into remote parts of the countryside, getting to talk to individuals and groups. And but COVID has taught us an entirely new ball game. We're able to get on, use technology, and reach out to far larger numbers sitting in the face-to-face meetings and online meetings are not the same. Each one has its own advantages, but we learn to live with the situation.
Right.
We're also
Right.
been designated as the cancer COVID hospital in the valley, and so all cancer patients who develop COVID infection come here. And it's been a learning. It's additional work, no doubt, but that's the job of healthcare professionals. Everybody, every profession has its own hazards. The man who's fighting on the border for the country runs the risk of being shot through the head by a bullet. The policeman who controls the riot runs the risk of being injured or even killed. People who go and fight insurgents, every profession has its own risks. Engineers who are on top of constructions could fall and get hurt. Same way, doctors, nurses, frontline health workers who are in a pandemic have run the discussion of run the risk of getting infected in the bargain. But that's so with every profession.
Right. Thank you so much, Doctor. What we would like to do in this session a lot is, unlike many a times when we have so many questions unanswered, we would like to take this opportunity with, of course, the approval of Dr. Kannan, that right from the onset of this session, if we can actually open out to questions and queries from any or
Yes.
many of the participants, right? So if anyone within the meeting who would like to raise or share a question or a query to Dr. Kannan, you're most welcome to use your mic. You can always ask a question, or you can even use the chat box and we can always read out the question for the doctor. So in case if people are still wondering about the question, I would like to ask Dr. Kannan, like some of the questions that we have actually collected from people around, especially that you mentioned to us the new challenge in COVID, which quite naturally restricts many of the cancer patients, including people who might want to get a diagnosis done, of maybe a suspected cancer case. How does one balance between the aspect of venturing it out, as you rightly mentioned, that you cannot go out to the open when the protocols are still on with high infectivity rate, and then you also have the newer concepts of telemedicine, which is now coming up across many parts of our country. When it comes to cancer treatment and diagnosis, what would be your recommendation to balance and trade off between offline and online diagnosis and intervention for their treatment?
Right. So there are two parts to caring for cancer patients during a pandemic like this. One is people who are already on treatment, chemotherapy, radiation, palliative care, surgery. Their treatment has to be carried on without any interruption. So what we have been doing is radiation therapy for patients on radiation therapy continues. Only thing is we have segregated everybody who's turned out to be COVID positive. At the end of the day, once the day's work is done, we bring all of them into the radiation block, give them radiation. The radiation technologist is suitably protected. And after radiation, they are all taken back to the hospital and um, um, the place is sanitized. Chemotherapy, especially for cancers of the blood, for hematological cancers, are best avoided during the acute phase of COVID, probably the first week of the infection, and then the time for the inflammatory response to set in for about 2-3 weeks. We don't administer chemotherapy. Surgery, same way, if somebody is tested COVID positive, we defer surgery for about 2 weeks because anesthesia and ventilation could have an adverse impact on the lungs of these patients, who are COVID affected. Palliative care continues without interruption. People who are in pain, who are suffering, who need home care, one of us has to visit homes of patients. This is continuing unabated because, see, the risk of infection, we understand after the last year's experience, this year we understand that the risk of transmission of infection increases as the protection level falls. If you're unprotected when you deal with somebody who is COVID infected, the risk of infection is higher. When you spend more than 15 minutes in contact, the longer the duration of close contact, the higher is the infection. And so, we have precautions. And and if you're at a closer distance, closer than 3 feet, the risk of infection increases. So when we see patients face to face, we generally finish the physical examination part as quickly as possible, and the rest of the conversation can happen over a distance with both people suitably protected. And this conversation, which is very important, which is so important in cancer care, is not really compromised. You answer all the questions, you talk to patient, you're sympathetic, you have empathy, and same thing happens in home care. Whatever has to be done in close quarters is done as quickly as possible, and rest of the conversation, prescription can happen at a distance. And so cancer care has to continue. See, if you interrupt radiation during treatment, after 20 fractions, patient has to receive 35 fractions, and at 20 fractions, you interrupt radiation for 1 or 2 weeks, the impact on disease control can be so much poorer. And so, patients will suffer. And so at all costs, we must try and not interrupt cancer care. Now, as far as diagnostics go, somebody has a suspicion of cancer, again, there is an urgency. And telemedicine cannot be a substitute for visiting a hospital for the sake of diagnosis. Now, what telemedicine can do is you can talk to a physician. He or she can look at your symptom list. It's not very easy to conduct physical examinations and all that on a telemedicine platform unless there is a doctor at both ends. And so a physician may be able to suitably advise you on the need to hurry up for investigations, or whether it is okay to wait for a few weeks and then go and have yourself investigated. That is the best thing that can happen from a telemedicine perspective. Patients who are on treatment and who are on oral drugs at home, or having treatment done nearer their homes, can talk to a consultant 2,000 kilometers away and take advice on to the further course of action. But some diagnostics, like HPV testing, can be, we can use self-collected samples and do the HPV testing in a lab which is away from the home. They can be collected through a common source, and some things can be done. But most of cancer diagnostics need the patient to go to a hospital. The only thing is, if you go well prepared, if you are protected, if you don't go to crowded areas, you can take an appointment in the hospital and go at the appointed time. Instead of going at 8 o'clock for 11 o'clock appointment, you just go a few minutes earlier, finish your investigations, finish your treatment, and go home. So by minimizing the time you spend in hospital, by ensuring that you have a double mask on all the time, by ensuring hand hygiene, by ensuring that you don't come into close contact with people for more than the necessary time, by making sure that you vaccinate yourself whenever possible, you will keep yourself safe and hopefully keep others also safe if you happen to be the source of infection.
Right. Doctor, talking about vaccination, we have a question from Sudeshna about the impact of vaccines, COVID vaccines on cancer patients, if any, if you can highlight that point for all of us.
COVID vaccines should be taken during cancer treatment also. somebody's on radiation, it's perfectly okay to go and take the vaccine. If somebody's on chemotherapy, you take the don't take the vaccine on the day you've taken the chemotherapy. Wait for 1 or 2 or 3 days, and then go ahead and take the vaccine. You take the vaccine today, 1 or 2 days later, you can have the chemotherapy. So vaccines are perfectly safe during cancer treatment. There is no need to wait for cancer treatment to finish or to interrupt cancer treatment in order to enable vaccination.
Doctor, the next question is from Yashashvi, and Yashashvi wants to know that if you can tell us about the use of nanotechnology in cancer treatment, if that is applicable. We were also reading, doctor, about the nuclear facility which was recently started at Silchar. So is there a nanotechnology intervention in cancer treatment yet?
So some basic nanoparticles are being used in some chemotherapeutic agents, but nanotechnology at the moment has not stepped into cancer care in a very big way. It has enormous potential, and the coming few years could see an explosion of the use of nanotechnology in various forms for both diagnosis and treatment. At the moment, except for some chemotherapeutic agents, nanotechnology is not used in the clinic in a very big way. The nuclear medicine facility at the cancer hospital is being established. Nuclear medicine does not have anything to do with nanotechnology. Nuclear medicine is using chemicals, substances which emit radioactive radiations, uh, uh, radioactivity, and that radioactivity is used to treat cancers. The advantage is when most of them use electromagnetic radiations which travel a very short distance, and so if it localizes in a cancer, only the cancer gets irradiated, and that is the advantage of using nuclear medicine in cancer care. Our facility will most likely become operational by August.
That's wonderful news. Praveen, doctor, wants to know the specific reasons for the high and percentage of cancer cases in Northeast India. If you would like to share that experience with all of us.
In my opinion, the single largest, biggest cause is tobacco and areca nut use. The amount of tobacco consumed in the Northeast is much, much higher than in many parts of the country. In the last global tobacco survey, very few, the overall incidence of tobacco use in the country came down. But some states, Assam, Tripura, Manipur, actually showed a rise in the tobacco consumption. Tobacco consumption is very rampant in the Northeast. There is also an excessive use of areca nut, especially raw fermented areca nut. And I think these two are the most important causes for the increased incidence of cancer in the Northeast. And there may be other reasons which contribute to some extent, including lifestyle, cooking, other issues. But to my mind, it is tobacco and areca nut which are the main culprits, and of course, alcohol abuse.
So what message would you like to share, to the people, doctor, of how do we tackle these lifestyle issues or this, habits, and how do we go about, addressing these points? What is your
So cancer prevention, is a very profitable business. If you don't use tobacco, you don't use alcohol, the individual will actually save some money. Now, when the individual doesn't use tobacco and alcohol, eats healthy, exercises well, treats various infections promptly, gets vaccinated whenever he or she needs it, or ensures the kids get vaccinated whenever they need to, what happens is the incidence of, you don't have to go to the doctor again and again, for different ailments. And so the healthcare expenditure for the individual will come down. Now, hospitals, will not need to spend a lot of money on expensive investigations in infrastructure. Healthcare expenditure will come down. And then if you look at it from a national perspective, if people don't fall ill, the productivity of the nation goes up, the GDP of the nation. Ultimately, what is the GDP of the nation? Your GDP, everybody's GDP put together is the produce of the nation. And so the GDP of the nation will go up. The government does not have to put in infrastructure as much as it is doing today. And so that money can be used for water, for sanitation, for education, for space research, for whatever you want. So, and then cancer is caused by tobacco, areca nut, alcohol, poor diet, lack of exercise, untreated infections. Now, what is the cause of heart disease? Tobacco, alcohol, poor diet, lack of exercise. What is the cause of strokes? Tobacco, alcohol, diet, exercise. What is the cause of diabetes? What aggravates hypertension? What is the cause of peripheral vascular disease? Whole lot of non-communicable diseases are caused by tobacco, alcohol, poor diet, lack of exercise, and sometimes infections. So when you prevent cancers, you're not only preventing, India is the diabetes capital of the world. India is the cardiovascular disease capital of the world. All disease capitals, So when you prevent cancers, you don't take tobacco, you don't use alcohol or areca nut, you eat healthy, you exercise well. So you're also preventing heart disease, you're also preventing strokes, you're also reducing the incidence of diabetes, of hypertension, of peripheral, many other diseases. And so what happens, cancer prevention is actually health promotion. You go out to prevent one disease and you prevent a whole lot of other diseases, you actually transform into a healthier community. When somebody falls ill at my house, who will take care of that patient, that individual? I have to do that. When somebody falls ill in our extended families, who is responsible? We are responsible. When somebody falls ill in the villagers take responsibility. Now COVID is happening, every household is supporting the next household. We as a nation have come together. So who is responsible when somebody falls ill at my house? It is me. The chief minister or the health minister or the prime minister will not come and take care of my sick man. I have to do that. And so as a extension, the health of our community rests with us. We as members of the community have to take responsibility for promoting health. And so one of the things we are trying to do, is create these communities for health. We engage with NGOs, with social organizations, with clubs, with youngsters, with schools, trying to, get this message percolated across the community that health promotion is a profitable venture. When you go out to prevent cancer or heart disease or stroke, you prevent many other diseases at the same time. Preventing one is akin to preventing many others. You're promoting health. And that is our responsibility. We are responsible. Health promotion is a national responsibility, as important as a responsibility as fighting the enemy on the border or maintaining peace during insurgency. It is as patriotic a duty.
Thank you so much. I think that really motivates and inspires us to help each other more. Dr. Debashish asks a question which might be important to many, that how are terminal patients being handled during lockdown? Are they being provided ambulance services for hospital visit? He asks.
Right. So what is happening, what will happen in any community is an additive effect of what governments do and what individual hospitals do by themselves. All of this is additive. So in Assam, for example, the government has mandated that anybody who has diabetes or hypertension or needs drugs at home during a lockdown phase, they have to call a number and the number will organize for the drug to be supplied. The ambulance will go and supply drugs in the individual's homes. What we as an organization are doing is we are ensuring that everybody who needs palliative care, needs home care, who are terminally ill, and we are making home visits. Home visits are meant for people ensuring that home care goes uninterrupted. We are going to people's home, we call them in advance, go there. do whatever we have to do, make sure they get access to morphine, other drugs. And so care of terminally ill patients is not hampered. Patients who have to come for chemotherapy from other districts, now there's the inter-district travel has been banned. We are talking to the district administration to ensure that there is facility to get patients dropped off for chemotherapy. And so, in these situations, every institution has to think for themselves out of the box, because the situation in Cachar is very different from the situation in Chennai, which is very different from the situation in Indore. And so every institution has to think for solutions which fit their requirements. But together, all of us working together, I'm sure, when people die, sometimes patients' families want to take them back, and sometimes patients' families do not want to take them back. And you have to ensure that both thoughts are handled with sensitivity and respect. Somebody wants to take the patient's body home is fine. Somebody who does not want to take the patient's body home is also fine. We are nobody to sit judgment on any thought process, and we have to handle both with respect, with care and sensitively. And so we have to ensure, we have to call, somebody in the government, somebody in the district disaster management committee, wherever, we have to place appropriate calls, arrange for ambulances, or arrange for a certificate so the patient can be. So all this has to be organized. So many situations arise for which we don't have a textbook answer. We have to, only thing is, we have to ensure that we deliver good quality care, but with compassion and respect in these trying times.
Thank you, Doctor. Another point which a lot of people are highlighting is that uh, specifically in the second wave of COVID-19, with rising infectivity all around, there has been a very deeper sense of mental health distress amongst different types of community at different levels. Now, when it comes to a cancer patient, mental distress can be an additional trigger to maybe complexities, for them. So what would be your piece of advice or suggestion of how to mitigate with mental health distress for the cancer patients likewise?
Yeah, mental health is a major issue, not only for patients and caregivers, but also for hospital staff, nurses and doctors who take care of COVID patients who face death day in and day out. It is traumatizing. And so mental health, and unfortunately, mental health is one of the issues which can be helped to a very large extent on telemedicine. You just asked me a short while ago. I said for cancer diagnosis, it may not be all that useful, but for mental health, it can be a very, very, very useful technology. To use technology to help people, both psychiatrists and psychologists, are very active on, telemedicine platforms for mental health. Cancer patients, they're already stressed out because of cancer diagnosis. They're afraid. And then it's a double whammy when they also have COVID, or somebody near and dear develops COVID, or there's a lot of COVID in the environment. They have that fear, that compounded threat to, one's own life because of COVID. They're afraid to come to the hospital because there's a lot of COVID around. Somebody has developed COVID in the house. They're afraid that they will get infected. But they're also afraid of not getting treated because that would mean growth, progress of the cancer. And so this requires extra care and constant reassurance and hand holding to ensure that patients suffer less. But this will happen inevitably, and anybody who has the capacity to listen quietly, reassure calmly, and will be an invaluable resource during these times. People who are trained psychologists, psychiatrists, counselors are good, but also volunteers who have been working with patients for a very long time, who just have the ability to listen to people, cry and complain, and express their fears without being judgmental, without having necessarily to suggest a solution instantly, are also very, very important. They will also help make sure that people who are extra stressed have access to specialized care. Not everybody will need a psychiatrist or a psychologist. Many people will feel better just by venting out their fears and emotions. And so volunteers will go a long way in helping all of this, in sort of providing a cushion to make sure everybody is taken care of.
Right. Thank you so much, Doctor, for validating and actually, I think, clearing a lot of clarity in the minds of some of the students from background of psychology or otherwise. And we had this, little doubt about whether qualified practitioners would be only, the ones who would be clinically or medically ethical to support cancer patients. But since you reiterated the fact that even someone who can listen and can create that, lending a year's support can also serve the purpose up to a strong extent. Right. And also, Doctor, one very important point, the reason why we are all together and why we are so, proud of Cachar, for basically trying to support people who cannot afford the treatment. If you would like to highlight that how people who might be diagnosed with cancer or who might be simply scared of getting a treatment done, keeping in mind the expenses ahead, how can Cachar support them uh, in their way forward? If you can also share some points on that.
Yeah, see, cancer treatment is expensive, but it need not be so terribly expensive, that it impoverishes the patient and the family for many generations, you know. And and I'm sure there are many organizations like ours, that try and reduce uh, the trauma on patients. See, we started off with simplistic measures. We were providing low cost or no cost treatment. We were providing food. We were providing accommodation. And then we realized many of our patients are daily wage earners. And since cancer treatment takes a long time, it becomes non-viable for them. If their daily wage suffers, even if we give them free treatment, they're not able to come and take treatment. So we started providing ad hoc employment on campus. Then we started the home care program. We got into phone call, calling patients, finding out why they have not come. The dropout rates used to be very high. The abandonment rates used to be, more than 70% at one point of time. And then we would get on the phone and encourage people to come. We would tell them, we would go out and support them. And then the Indian Cancer Society started supporting us for some patients. Slowly, one organization, more organizations, then the state insurances started. And so now, we are able to support almost 80-85% of our patients to a small or a greater extent. But then, apart from providing free treatment, we also have to ensure that patients are able to access treatment. So we started satellite clinics in each of the districts around us. We do a clinic once a month and see all the follow-up patients in those clinics. Many, and then reducing recurrent expenditure. Patients, for them to we used to charge consultation fee every month. 120 rupees or something. And then for patients coming again and again, it becomes a large amount. So we said one-time payment, and after that, there's no further consultation fees. Same way for dental care, one-time payment, no further. For a lifetime, they will get dental care without charge. So that, multiple things. We resorted to frozen sections. See, pathology is a heart of all cancer management. And what typically happens is a biopsy is taken. It takes 2 or 3 days for the report to be ready. So we resorted to frozen section. We freeze the tissue, and within 2 hours, we have a diagnosis. And so all our pathology works on frozen section. So the diagnostic period is shortened. Patient comes today, by tomorrow evening, the diagnosis, the stage, and the treatment plan is ready. And then they go back and get ready and come. So many things have to be done in order. And then we created a department that will coordinate all these activities, make sure every patient gets the support he or she is needed, puts together the document, makes the applications, calls people. Lot of background work happens, but then all of this can only happen if the entire organization is on the same page. From top to bottom, from the director to the doorman, everybody must have this in their mind, that the organization is looking at ensuring equitable health care, cancer care to every single patient who walks into the hospital. And so this has to be done with compassion, with respect, without undue delay, in a hassle-free manner. Patients must feel wanted, must feel secure coming in. And so it is validated, when patients lose their battle, the family members 6 months, 8 months, 2 years later, we'll come back with more patients. You treated our patient at that time, and now we have another patient. My patient died, but that's okay. He was well cared for, and so this happens. That is how. But the everything will happen if the entire organization is on the same page, and that is the key to delivering good patient care. I read somewhere, in order, the secret of good patient care lies in caring for the patient. And that is so true. Unless you care about the patient, you cannot deliver good quality care. And so that has to show in every possible manner for every possible need.
Thank you so much, Doctor. I would like to ask maybe one last question, and we would like to take like a sum up of the session. This comes from Jayashri, who is unable to join the session today, but she writes to us that I am a cancer survivor. I had non-Hodgkin's lymphoma. My treatment has ended by 2017. 2017. Since then, I have not taken any medicine for cancer. I want to ask, sir, that can I take the vaccine for
Yes,
COVID-19?
emphatically, yes, you should. And all the best.
Right. So we would love to maybe share this video clip back to Jayashri as her, answer. Thank you so much for answering the questions, Doctor. We would like to maybe uh, ask the audience, in case there is something which is still on your mind, which you would like to share with us. We have like around 10 minutes of time in our hand. We have captured Dr. Kannan, to answer to our queries. And we would also like, on that note, to share with him back that, as you rightly mentioned, that the mental health situation also needs to be looked upon when it comes to the doctors and the nurses at this hour. So, Doctor, I'm sure as a collective group of people attending your session and wishing well for you and Cachar, we would also like to tell you that we are always there in some capacity in case you need to reach us
Oh,
back.
thank you.
Right.
Thank you very much. I
Right.
appreciate that very deeply.
We are so glad. We would like to definitely, maybe request if Naresh is there in the session from Cachar, or even Sharmi, if you want to just highlight a point for this
There's
session
just
to be.
one question that came up. I'd like to answer that, to highlight the role of nutrition and exercise in cancer. So, see, ultimately, just two sentences. Ultimately, what we eat is what makes up our constitution. If we eat a balanced diet, adequate amount of proteins, calories, fruits, vegetables, vitamins, we will stay healthy. And if we keep a watch on our weight, we are not obese. See, obesity is one of the risk factors for many diseases, including cancer. There are some chemical changes which happen in the fat cells in the body, which give rise to certain hormones that increase the risk of a variety of cancers. Obesity also is a risk factor for heart disease and diabetes and hypertension and stroke and so what I said earlier, cancer prevention is health promoting. It stops a whole lot of other diseases from happening. And so it is very important that we eat healthy, we exercise regularly. By exercising, I mean we must have cardiorespiratory exercises, we must have weights, and we must have stretches. That is what will complete the exercise story. And so spending time in exercising, making sure you eat healthy, avoid tobacco, avoid alcohol, avoid areca nut. Good prescription to staying healthy. I'm done. Thank you. Sorry.
Thank you so much. Thank you so much, Vandana, for asking that very important question. Sharmi, doctor asks, I think she may be not only asking a question, but also sharing a remark that smoking causes cancer is written everywhere, but why not is it mentioned on alcohol?
These are all social issues, So tobacco has become the big bad boy, and everybody loves bashing tobacco. and the tobacco companies. But alcohol is there is no safe alcohol. Earlier, you used to say, you take a small peg and it will keep heart disease away. That's all stories. It doesn't work like that. Alcohol is a class 1 carcinogen, and it causes a whole lot of diseases, including a variety of cancers. And so tobacco also is a social issue. It is not only a medical issue. Same way, alcohol is also a social issue. Tobacco, it is easy to ban smoking because you publicly pollute the air, and so everybody can complain. And so it is easier to ban smoking tobacco. Remember, we have not been able to ban chewing tobacco. Same way, alcohol, which somebody consumes, but it does not, pollute the environment. And so it is more difficult to control substances that do not harm others other than the user, and that is why it has been a difficult game.
Right. The questions are going on coming, Doctor. Priyal asks that, um, uh, how much accessible is cancer treatment in India? And why do celebrities go abroad for cancer treatment? Question mark.
You have to ask the celebrities that, But what I want to tell you is, in India, almost everything is available for a fraction of the cost that it is available in the West. Only thing is, it may not be available, proton therapy may not be available to everybody in the country. But then there are hospitals, and over time, this will change. But standard cancer care is available in almost every cancer center in the country. There will be differences in, outcomes and quality, depending on, expertise available, depending on many situations, conditions. We don't want to go into all of that. But then standard cancer care is available in most parts of the country, and almost all cancers can be treated in India. I don't think people need to go abroad for any cancer care.
That's very reassuring, from your end. And based on the same lines, Rohan Doctor adds and asks, to what extent the preventive side of oncology is taken care in our country? And what is the status of gene therapy and its affordability?
Right. So gene therapy at the moment is not useful in the clinic, except for, very small numbers. Routine gene therapy is not useful in the clinic at the moment. But like nanotechnology, gene therapy also is likely to play a big role in cancer care in the years to come. Preventive oncology or health promotion does not have to be a doctor's domain. It does not have to be a hospital's preserve. It has to be the responsibility of every one of us in this room. Every one of us can spread information about healthy lifestyles, encourage people, become role models, talk to school kids, talk to college students, it is important that every one of us becomes a leader in health promotion. And that does not have to be the domain of the doctor or the hospital or the government or any single person. Every one of us is a leader in health promotion, has to become a leader in health promotion, has to be a health promotion advocate. All of us must be advocating healthy lifestyles. We must become advocates for healthy lifestyles. Only then the situation will change in the ground. If the rule comes from the top that tobacco is banned, we will surreptitiously use tobacco. If people talk about, alcohol, whatever, we like, going against the recommendation. And so it will not work like that. It is every one of us must take responsibility for the lives of our lives and for the lives of our fellow citizens.
Right. And one final question, Doctor, comes from Dr. Gitanjali Goswami Himanka, asking, is it effective if we eat the black color part of roasted fish or roasted chicken?
Yeah. So when you so follow certain cooking practices, uh, unfavorable chemicals build up, nitrosamines, and so it is good not to use small amounts now and then will not harm you. But as a routine, if we start following these practices, they could hurt our health in the long run. Once in a way, if you eat these, it is really okay.
So thank you so much, Doctor, for your invaluable time. Some of the points that you mentioned truly has, I would say, pepped all of us. With a lot of clarity. There's a great deal of hope. There's a kind of a clear light, at the end of the tunnel, that at this moment we are all in. Um, we would just like to kind of iterate that, like Dr. Kannan maintained throughout the session, that it is a collective responsibility. I think these words of the collective responsibility to promote health should be what we take back from the session to the biggest possible extent, and it should resonate within all of us.
See, that's
Doctor.
what COVID has taught us, that each of us is very closely linked to others around us. None of us live in a silo, live in a tunnel. And we are dependent upon each other for our safety, for our well-being, for disease prevention, for health promotion, for supporting each other through difficult times. There are so many heartwarming stories about how people have helped each other in these difficult times, and that, I think, is the biggest learning from this current pandemic.
Thank you so much for your time once more. Thank you so much, participants, for making it to the session today. As Dr. Kannan mentioned and requested all of us, please, let's take our own responsibilities to ourselves, like how we are taking care of our neighbors when they're falling sick. We maintain the COVID protocols. We maintain the confidence in our medical systems, in our social systems, to really take this forward. On that note, I would definitely like to round off the session for everyone. Thank you so much, Team
Thank you.
Cachar, for enabling.
Saurav, can I just come in quickly to thank
Naresh,
you, Saurav? And I want to thank Catalyst, thank all the attendees, doctors, social sector professionals, social sector students. I also want to invite you to support our work at Cachar. Sharmi and I and Darshana, we are volunteers for Cachar Cancer Hospital. We've come together as a band of volunteers. So I have a request. We'd like to, through Catalyst, request each one of you to become a friend of Cachar Cancer Hospital. So we can send you details of what that would mean. But a lot of it really is helping us support the fantastic work that Dr. Ravi Kannan and his band of professionals are doing in Cachar. So I'd like to ask each one of you to become a friend of Cachar. So on that note, Saurav, Catalyst, and each and everyone on this call, thank you for joining us. And thank you for your questions. It was absolutely wonderful. All the quality of the questions and of course, Dr. Ravi Kannan's elucidation on that. Thank you once again.
thank you so much, everyone. Thank you so much, Naresh.
Bye
We
bye.
will all.
Stay safe.
Thank you so much, Doctor. You stay safe too, and our best wishes are with you, with your team, and we will certainly be sharing the necessary details that Naresh mentioned with every participant to see the scope ahead, where we can become the friends of Cachar and take our mission and vision forward with Dr. Ravi Kannan and his team. Thank you so much for your